How's it going? To therapy or not to therapy? That is the question. Welcome. How are my clowns doing? Welcome back. Shade's Clarity Channel. Today I am going to talk about psychoanalysis or therapy. And you may have considered it for whatever reason. Maybe you have depression or feel you need medication, you need someone to talk to unload. Tell someone all your problems and be assured that it is, be assured that it is kept confidential. You have your psychiatrists, which are medical, they're doctors, and then you have psychologists, which have their PhD in, I guess it would be psychoanalysis or psychology. And they don't prescribe medicine. And from my experience, I've had both, and some of them have been good, some have been bad, some have been fair to middling. The one that I have, yes, I have a psychiatric DO. He's a DO, doctor of osteopathy. It's a little bit different from an MD. They're still regarded as doctors. It's the same, but they take a more holistic approach. There's a little more art involved in what they do and treating the whole person instead of just relying strictly on science. My doctor is a DO, and he's one of the best I've ever had. And he's a subscriber to my channel. As a matter of fact, he watches it, and I saw him yesterday, and I spoke to him. I said, is it ethical that we exchange emails? Is it ethical that you are a subscriber to my channel? And he said, no. He said, that's fine. So he's also my medical advisor on accuracy and everything. So that's pretty cool. And he's very, very good. He listens. And the thing about it is, he was a psychologist before he became a doctor. So he sits down and listens. He sits one-on-one with you and will talk to you about whatever's on your mind, whatever, and he'll prescribe the medicine. I've had psychiatrists in the past that all they do is just throw medicine at you for depression, anxiety, etc., whatever. And I find that to be a little impersonal. I don't really like it. What would happen is he would see me for like maybe 5 minutes. This, how you feeling? How you sleeping? How's your mood? That'd be the end of it. Then I'd be pawned off to a social worker or a psychologist that would do all the talk therapy part of it. I'm not quite sure what you would do if you don't have insurance. In this situation, there probably are options. I would look that up if you're considering going into therapy. There's a lot of benefits from it. Of course, it's confidential. They can't disclose anything to anyone for any reason. There are a couple of reasons. If there's abuse involved, if you're threatening to harm yourself or others, that is usually reported. Cases of child abuse and other things of that nature are reportable. They will be reported to the authorities if you disclose anything like that. Otherwise, you can tell them anything. It's like talk to a priest. I find it very, very helpful. He's helping me with the Valium taper that I'm on. Also, I take Celexa. It's a SSRI, a serotonin reuptake inhibitor. You've probably heard of it. It goes by Celexa or citalopram. And I find that it helps. And I just go in there. He asks me, how I'm doing, and I just let it rip. I tell him whatever's bothering me. Like, I had a little rough patch there a few weeks ago. We talked about that. Just some depression issues, some motivational issues that we needed to talk about. And these are like the benefits that you will get from it. And I know you've seen all that ads for BetterHelp, the online. I don't know if you're annoyed by those ads. I don't know. I've never used BetterHelp. But that's telehealth, and I have had a therapist where we just met. I used my laptop computer, and it was a Zoom meeting. Or actually, it wasn't Zoom. It's a medical type service. I can't remember the name of it, but it's just like Zoom. And you talk to them, and I find that a little impersonal. I would rather go. I'm old school. I'd rather go and see somebody instead of just blah, 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 just rapping to someone on a screen that I've never met personally. That's just my preference. And I've found a really good doctor. My doctor was excellent. So if you're watching, you're good. Shades thinks you're the best. All right, enough blowing smoke up his butt. I mean, you will find it very cathartic. And if you're holding back, like maybe you're embarrassed, you don't feel like talking to strangers, or maybe, they would be able to help you with an alcohol use disorder or a substance abuse disorder of any kind. If you were to see one of these doctors, a lot of them will manage outpatient detoxes. I had one, not the doctor that I see now. He did it once, and then after I relapsed, he told me he wasn't going to do it again. But he gave me, I think, 20 Librium capsules to detox at home, and I did that. I think I stayed sober maybe 3 or 4 months, relapsed, got sober again, relapsed. You know the story, you know my story. It's long and distinguished, kind of like, It's your choice if you want to go telehealth versus one-on-one talk therapy. You may feel more comfortable doing telehealth. It's a lot more convenient because you don't have to leave the house. You don't have to, get in your car and drive maybe 20 miles to the doctor's office to have your appointment. The only problem is you can run into technical glitches. I've had that happen where we're talking, screen goes black for whatever reason, something wrong with the connection, or it lags a little bit. Then you've got to text them, or they text you, and you got to set up another meeting. I've had that happen. That's really the only downside to that, if you would prefer telehealth. Again, I don't. But really, if you're struggling with any sort of mental health issue, you feel like maybe medication would help, I would highly recommend making an appointment with someone. And you could shop around. If you don't like this one, maybe have that one recommend someone else. Tell them your personality characteristics. I like people that are, more personable. Have a really good bedside manner, like even though you're sitting there. It just comes down to personality. And I click with my therapist very well, and I'm fortunate. The only downside is he doesn't take insurance, so I have to pay out of pocket. And that's really all I got to say. If you're struggling, talk to somebody. It will help. It will get all this garbage out of your brain. Your head is a bad neighborhood. It'll help with all that. Things you may be holding on to too long that you feel like it's time that you talk to somebody. It's really, really good, and I highly recommend it. But please check out some of my other videos. Like and subscribe. Channel's growing a little bit. I'm going to be going on another podcast next week, and I will probably do a short with the details about that. So you can come over there and toss all the brickbats you want at me. I'm used to it. Take shades off. Take shades off. You're creepy. You're creepy. Take shades off. But with that, stay tuned. Come back. I'll see you clowns later.